Welcome back. The COVID-19 pandemic has triggered a community solidarity movement to help each other. Various initiatives were carried out in the midst of the government's limitations in dealing with the pandemic that had occurred for more than a year. The COVID-19 pandemic has triggered a movement of solidarity to help each other. Various initiatives were carried out in the midst of the government's limitations in dealing with pandemic, which had been going on for a year and a half. Some movements are done virtually, such as free doctor or psychologist consultation services. Likewise, public figures who provide free advertising or endorse services for small business actors affected by the pandemic. In addition, fundraising and basic food assistance were also carried out for people who were in self-isolation. These various actions are a response to the government's slow, ineffective, and confusing policies that encourage people to act spontaneously on humanitarian grounds. However, the government still needs to encourage these grassroots movements. This is done by acknowledging and facilitating the existence of volunteers and helping prevent abuse and fraud. IDX Channel reports. In the midst of a surge in COVID-19 cases, most COVID-19 patients without symptoms and mild symptoms are forced to self-isolate at home. Other difficulties are also felt by residents affected by the pandemic. Even so, solidarity actions continue to emerge with the aim of helping others. So what actions of solidarity were carried out? Let's check the list in the first graphic. We can see the community solidarity in a virtual basis. Free doctor consultation, free endorsement for business, donate money and basic necessities, free counseling service, fundraising, and also socialization related to COVID-19. And seeing the number of COVID-19 patients is surging, a doctor in Yogyakarta, Rio Pungki Irawan, opened a free medical consultation. And the idea for the health consultation service started with main friends who are in isolation at home. He was also contacted his fellow doctors to ask for help, and there are already 30 doctors who work together with the medical consultation services spread across hospitals in Yogyakarta, Jakarta, Bangka, Batam, and Medan. Not only virtual, solidarity movements are also carried out non-virtually. We'll see some of the action in the next graphic. So community solidarity non-virtual, PPE manufacturing, provide a place for self-isolation, public kitchen is provided, oxygen cylinder loan service, coffin making, and ceremonies and funeral. And solidarity action also came from a group of the solidarity movement of 1 million antigen tests for Indonesia. This group provides free oxygen cylinder landing services for COVID-19 patients in the greater Jakarta area. The implementing team for the solidarity movement, Arif Bobil, said in a day as many as 40 sets of oxygen cylinders along with regulators, nasal passage, and other tools were borrowed by residents in need. So from these various solidarity actions, which sector dominates? Let's check the answer in the next graphic. So the sector dominates the social solidarity, health sector by 53.5%, and then logistics 33.1%, economic empowerment 7%, education 1.4%, and others for 5%. PIRAC, together with the National Amil Zakat Agency and Dompet Duafa, carried out a social mapping of community solidarity. In their research, more than half, or 53.5% of aid was given to the health sector. Further attention is directed to the logistics sector, economic empowerment, and education. These various actions of citizens are response to the government's slow, ineffective, and confusing policies that encourage people to act spontaneously on humanitarian grounds. So what should the government do to address this? Let's check it out in the next graphic. So what should government do? The first thing is acknowledge the existence of volunteers. And the second one is facilitating volunteers and provide data support and help monitor to prevent abuse or fraud. And yes, the government still needs to encourage this grassroots movement. This is done by acknowledging and facilitating the existence of volunteers and helping prevent abuse and fraud. And hopefully the government can balance the solidarity of the community with various policies that are firm but do not further suppress the socio-economic conditions of the community. And stay tuned, market headlines will be right back after this quick break.